Everyone out there knows that our confidence comes from the way we look and feel. And because we all have different skin types, we frequently need a unique solution for all our skin types every day. This is why MediHerb introduces MediHerb Turmeric Soap with turmeric extract and argan oil that has anti-inflammatory and antibacterial benefits. MediHerb Saffron Soap with saffron and almond oil, which are vitamin
Thank you so much for joining us once again on the Chaz program, where we continue looking at malaria. And now today we are looking at malaria in children, and we'll be able to get more information concerning that. My name is Christabel Munga Chilea, and thank you so much for joining us this morning. All right. We have seen that malaria has been found in Lusaka. This recent past, we were told that in Lusaka there is no malaria. But what happened, or what is going on for us to be having malaria? We'll be able to get more information again concerning that. And to help me discuss this topic, I am joined by Mr. Afet Mbutao, who is public health scientist, clinical officer general at Mandevu Pediatric Center. You'll be able to
Pediatric Center.
Pediatric. I don't know. Welcome to the program.
Thank you.
All right, it's good to have you this morning.
My pleasure.
And also I'm joined by Mr. Malao Jonathan, who is a health promotion officer, environmental health officer, and he is coming from the Lusaka District Health Office. Welcome, Mr. Malao.
Thank you so very much.
It's good to have you again.
Thank you.
Today.
Definitely.
All right, we are discussing malaria in children, and obviously you will be able to tell us malaria in children and in adults. It is a different thing. So you'll be tell us what is important for us to continue putting this subject of malaria and also the response concerning this cause of malaria in our communities, as well as the prevention of this cause, malaria, Mr. Mala.
Ultimately, this is because malaria is a serious disease, and it's one of the leading causes of deaths in the world. Hence, there is need for us to keep talking about it in order for the members of the community, the people out there, to keep being sensitized about it and its dangers, so that they keep preventing themselves from catching this disease, malaria, because it's very dangerous.
Okay. Yes. All right. Now, what is the overview of malaria in Lusaka? Because in the recent past, we were told that there is no malaria in Lusaka.
Oh yeah. So for Lusaka, just like we have put it, in the recent past, the past few years, we have not had malaria, but the narrative has changed for Lusaka district, as that now we are recording malaria cases just from within. Despite when patients come to our health facilities, there are those that are presenting with signs and symptoms of malaria. They are even diagnosed to be positive having malaria. From the history that they have traveled out, but there are also those that are coming from endemic areas within Lusaka district, which are presenting with malaria. So apparently, I will say, as at now, for instance, in the past week, and as Lusaka district, we have recorded 719 cases of malaria. That the entire number, 719, is spread across all the 7 sub-districts, which are the 7 constituencies of the district. So the ones which are having the highest numbers are the 3 sub-districts in Lusaka district. Number 1, that is the Munali constituency, Munali sub-district, which is having 154 cases of malaria. And then we have Mandevu sub-district, which is having 193 cases, followed by by Matero constituency having 118 cases, and the rest are also spread across the remaining sub-district in the district. So the entire number of cases that we have had in the previous week, that is 719 cases of malaria. Hence, there is need for us to keep on sensitizing the people so that they know that malaria is still existing in our country as well as in our district, Lusaka district, which has been known not to have cases of malaria.
All right. Before we come to Mr. Mutao, tell us, what is it that we are not doing enough apart from sensitizing? Because looking at these numbers, they are so alarming.
Yes. So on the other hand, we might say that perhaps having known that we do not have malaria in Lusaka, we might have dropped the guard against concerning the prevention. The prevention of malaria. That is sleeping in the mosquito nets, as well as ensuring that we clear the grass that is around our households, as well as clearing the water that accumulates around our households. Because we are just coming from the rain season, and usually we have water that accumulates around our households, and hence there is need for us to clear it by draining it, so that we do not encourage the mosquitoes to keep breeding within the water, such that when they multiply, they start coming into our houses to bite us. And also, I think some of the households, perhaps in some of the isolated compounds, you find that maybe they are unable to buy or to acquire mosquito nets. So some, they might be using even worn out mosquito nets, hence the need for them to use new ones.
Is there a lifespan for mosquito nets?
Definitely there is. So there is a lifespan. You find that when it's completely worn out, maybe they become, when a mosquito net starts to be torn, it needs to be done away with, because even the chemical that it was chemicalized in the beginning, you find that it has completely worn out. So there's need to change it.
Okay.
Yes.
All right, Mr. Mutao, Mr. Malao mentioned about the symptoms of malaria. What are some of the symptoms that someone might present for them to say, okay, these are symptoms of malaria?
Okay, so symptoms varies from person to person, but if we were to generalize them, usually both in adults and
in children.
Usually there is a fever, persistent fever. Some come with vomiting. Some have got general body malaise, like body pains. There is also joint pains. There is body weakness. There is sometimes even confusion. There is also sometimes unconscious. Sometimes even convulsions if it goes to the severe form of malaria. Yes.
Okay.
So mostly those are the general symptoms of malaria. But they can also present in other cases. Yes.
Okay. Because when we just feel, maybe you just have a fever, or maybe you're just tired, maybe body aches, you just say, I think I have malaria. Then you self-prescribe. You go to the pharmacy and buy, of course, Coartem. Then you start taking. Then when it gets worse, you go back now to the clinic. I think that is more dangerous on our part, like you have mentioned, that it can present even in other cases.
Even self-medication is not actually a good thing, because sometimes when you do an ARDS, it will just tell you are positive. But when you do another, is it microscopy, where it will tell you the number of parasites that are in your body. So it will help us determine which route and what type of medication we are going to give. Because Coartem alone, in the most severe form of malaria, it's a very difficult thing to treat. So going to the hospital and have and get diagnosed, sometimes we may not have even the microscope, but as a health care professional, I know the severity and the stages of malaria. So I'll be
affect children differently compared to adults.
So malaria affects children in that children still not as strong as compared to the immunity of an adult person. So you find that children, their immunity is still being built, and that is why we encourage that they need to be kept in an environment that is safe from there for them not to easily catch a disease. So their immunity definitely is what we try to ensure that it needs to be safeguarded because their immunity is still as low compared to the immunity of the elderly ones. So that is the difference between them and the adults.
Okay.
Yes.
Are there any risk factors?
So the risk factors for children to catch malaria, you find that if the children or a household are found in a place that is endemic to malaria, or a place that is prone to malaria, that is infested with mosquitoes, that is a risk factor. So that is why we encourage that if you are in a mosquito infested area, you need to sleep in a mosquito net. The children, we need to ensure that we put them in the mosquito net as they go to sleep, so that they are prevented from mosquito bites. And then if there are accumulation of water around that can encourage the breeding of mosquitoes, that water needs to be drained. It can be in the cans, it can be in the tires, those areas, those items. If they contain water, the mosquitoes can harbor in those areas and they can start breeding. If there's grass around, we encourage that it needs to be cleared. So the risk factors, especially in endemic areas. So endemic areas, there are areas where mosquitoes they usually harbor there, and then they can have easy access to how to bite the people that are around.
Okay.
Yes.
Now, taking you backwards, you said that Munali has the highest number of cases for malaria.
In the previous in the previous week.
Yes, in the previous week.
Mandevu, in fact.
Mandevu. Okay.
Yes.
What could be the cause of that?
So Mandevu, okay, I think it can be by chance.
Okay.
And then on the other hand, there's a part of Mandevu that overlaps with Chongwe, and then there's also a place that is we can say it's more of some kind of weight, and it also overlaps with Chiwombo. But there are also, especially a place where water accumulates very much, and then there are more mosquitoes. But it can also be a matter of chance, because these are figures that are just gotten within a space of a week. So we may find that perhaps Munali, or maybe even Lusaka Central, where we also overlap, Lusaka district overlaps with Chongwe, again on the other hand, where we have State Lodge Clinic. So we may find that even there, there's a chance that cases can go higher, surpassing the other sub-district. So these endemic areas, we may find that it's different. For example, like Lusaka Central, where we have State Lodge, it's different from Kawata constituency or Kawata sub-district because of the areas. Because we find that some areas have got water that is still accumulated, or they've got some streams that are passing nearby, and then that area, you find that it's more prone to mosquitoes that are biting people.
Okay.
Yes.
All right, now I understand.
Sure.
Yes, Mr. Mbutao, tell us, how can caregivers identify or see severe malaria in children? How are they able to tell?
Okay, so when you are living with a child, obviously you know the routine of a child, and again,
They're
it also
active.
varies also with the age.
Oh.
But a child who is less than 1 year is very difficult to tell if they are sick. But the most important symptom that you can detect from a child is persistent fever. A child is having persistent fevers, and when the temperature goes high, like too much, the child will succumb to convulsions, what we call febrile convulsions. Then they will be irritable. They will be having difficulties with breathing. When you have got so much parasites in your body, there is a way a body responds. Of course, there will be the irritation of the vagus nerve, which will cause a cough, also maybe even difficulties with breathing with a child. There will be a lot of physiological changes in a child. So fever is one of them, like persistent fever. They will be irritable, difficulties breathing, sometimes even vomiting. And those are the most important signs to look out. You don't wait for a child to start convulsing for you to rush to the hospital, because convulsions can be fatal.
Okay.
Yeah.
So-
So for caregivers, it's important for them to pay attention to the fevers, the irritability, and the activity of the child.
So at one point, can a child start having convulsions?
It
At what point, at the level of the temperature, can a child start?
usually above 38, it's very dangerous. They can convulse 38, 39, 40, 41.
Oh, okay.
They can convulse, yes. Because recently I saw a case. I passed through Mandevu, and then I found the child was in. I was admitted
Mhm.
in our small ward. When I looked at the file, I think the temperature was 41 at admission, and then they had over 2,000 and something parasites. I think 2,144 malaria parasites in their system. They were on artesunate. So there was no history of convulsion in that child.
Mm.
Yeah, but usually when the temperature is too much for a child, convulsions are likely to happen, and we call them febrile convulsions, caused by malaria parasites.
And you can control that.
Yes, you can control that by tepid sponging, maybe giving paracetamol, but you have to rush because you're not treating the cause, you're treating the symptom.
Mhm.
Yes, so the most important thing is to rush to the hospital.
Okay.
Yes.
All right, Mr. Malao, now what should people in the community do when they see someone, especially children, that are presenting with signs and symptoms of malaria?
I think in answering that question, building on what Mr. Mutawa has just mentioned, when we begin to see signs and symptoms of malaria in a child or in children from the community, from our households, it's important to take that child, to get that child and have them taken to the nearest health facility, because it will be unfortunate if we start waiting. A child may start convulsing, just like he has mentioned. So when you begin seeing signs and symptoms of malaria in a child, it's important to have the children taken to the health facility in order to safeguard the lives of the children.
Mhm.
Yeah, and I think it can also help, because just like he has mentioned, like the first signs of fever,
Mhm.
high temperature. Some they may start medicating these children at home, but without knowing to say what is the cause of the high fever or other signs and symptoms that may present like malaria signs and symptoms. So it's important to have these children taken to the nearest health facility for the qualified health personnel to take a look at them and manage them.
Mhm.
Yes.
Okay. Now, how can we control children? Are they getting this malaria just by bites, or maybe there are some other things that we can do as parents to control these children?
Well, malaria, it may.
I've said so, Mr. Malao, because one parent can say, in Vanamanga, they always have mosquito nets, but I don't know why they have malaria.
Okay. So it's important, I think, when children are known to be sleeping in the mosquito net,
Mhm.
yeah, we may have that knowledge and that practice to say, for me, my children always sleep in the mosquito net. But you may not know as to when a child have been bitten by a mosquito. Of course, like a malaria-causing mosquitoes usually bite between 22 and 04 hours. That's when they are more active. But at times you may not always be there to monitor whether a child has been bitten or not. So it's important to ensure that when you see that a child is presenting with signs and symptoms of malaria, they are taken to the nearest health facility, and you cannot easily take it for granted to say just because you ensure that the child is in the mosquito net or they sleep in the mosquito net, then they cannot get sick of malaria. No. The chances are there to say a child may be bitten at any point. Of course, we know, and it's scientifically proven to say malaria only comes by a mosquito bite and not any other, not any other thing.
Okay,
Yeah.
so what is the Ministry of Health doing about these numbers that we have heard that are rising each and every week?
Okay, so on our part, like Ministry of Health as Lusaka District, we intensify on surveillance activities in our district as well as the sensitization. So let me mention, like, on the part of sensitization, for example, like on our part, from our end in our health facilities, there's health education that is usually given to the caregivers who come to our health facilities. Even just people, they may be seated in OPD, they are waiting to be attended to. We have some people who go there, they may be healthcare workers, maybe volunteers. They give health education on how to prevent themselves from malaria, depending on what has been found. So health education is given. And then on the part of mosquito nets, it's very important. For example, the expectant mothers, as they come for antenatal visits, we have the Department of Environmental Health that usually has got mosquito nets. And as mothers come for the antenatal visits, they are also encouraged to visit the environmental health office so that they are given a mosquito net. They are supposed to prevent themselves from malaria, as well as preventing the unborn child from malaria. And then also, with those that have got under 5 children, they are also given mosquito nets, so that the children, they are prioritized. They are given mosquito nets so that they sleep in the mosquito nets. Yes.
Now,
that is beside other preventive measures that are done by Ministry of Health, like the indoor residual spraying, where we go door to door to spray. So this activity is usually done every year, and then we train the spray operators who do the actual spray in the houses, and then we also train the mobilizers who go before the spray operators, so that they sensitize the community, the households. They tell the people to say there are spray operators that are coming behind, so the households are encouraged to allow the spray operators to do the spraying of the houses to prevent the people from malaria.
Okay. Before we come in with Mr. Mutao, if you are given a mosquito net and now you go home, you know there are talks in these communities that once you just open the mosquito net and you start using it, it has some chemicals that can react on your skin. What are you supposed to do? Are you supposed to remove it outside for some time or for some hours, then now you start using it?
That's a very important question. So for a mosquito net, when they are given, it's still in the plastic. They will be advised from the health facility by the personnel who will give them. So they can either get it and put it in the sun for it to for air to pass around it, and then so that it will not be irritable to the users. So for some time or for a few days, they will be encouraged to get the mosquito net and put it in the sun and retain it. And then on the other hand again, they can either get it, put it in the sun for some days, or they can get it and put it in lukewarm water, not hot water. Then yes, in lukewarm water for some minutes, so that that chemical will not be irritable as the users will put it on the bed for use. So those are the two ways that the mosquito net can be prepared for use. Is either putting it outside in the sun for some hours, of course not like the whole day, but for some hours, for a few days, or we put it in lukewarm water. Yes.
Okay. Mr. Mutao, how effective are malaria vaccines for children?
Okay, so on the vaccine, I think it was not it has shown some effectiveness in some children, and it has helped to prevent malaria in some children. So though the study is still going on, like it's not fully accessible even here in Zambia.
Okay.
So have you ever seen a vaccine in Zambia yet?
Not yet.
Yeah, so it's not according to the studies, they are saying it's effective to some children, but they are still doing studies and recommendations. So I think we have to give it some time and wait for the specialists to advise on when it can be given and how effective it's going to be. But for now, it has shown some effectiveness. They haven't even said the percentage accurately, which the vaccine can prevent, like malaria.
All right, but even though it can be like that, vaccines help our children to prevent them from other diseases, but there are myths also concerning vaccines. It might be these vaccines. Last week, children were receiving polio.
Yes.
And they say, me, I can't take my child for polio because once I take my child for polio, they now get sick. Some, they react, their skin have rashes. So I think you need to say something on these vaccines. I know we don't have malaria vaccine yet.
Okay, so I'll tell you something, and this is like very important to everyone watching. You know, every drug has got its own side effects. There's no drug which is 100% safe, but there's what we call if the benefits outweighs the risks. So do you risk your child having polio or a simple rash which can be treated? So you have to choose between the two. So when you look at most vaccines have been very, very effective, like the polio vaccine. Polio is one of the most dangerous diseases. Once you have it, it has got poor healing process. Actually, it might even leave a permanent damage on a child. So when we say we are going to give polio vaccines, we know why we are giving, and we understand, yes, some children will react, but there are very minimal people who have come out to say my child reacted. You know, myths and conceptions when it comes to medicine in this whole world, they will never cease to exist. People always have everything to say about I'm sure you've even seen this on. There are people who talk about COVID to say from the time we took that vaccine, this country has never been normal, you know. So, but the important thing is, most people who got vaccines, like for me, from the time I got the COVID vaccine, I rarely have a cough and a flu. In fact, I don't even have a flu in the longest time. It's very rare that I even have a flu. So, vaccines also work different in human beings. For some, it helps even not even to get the flu. Some it prevents how far the disease can go in them. They'll have the disease, but it will prevent how far the disease could go. You get the point. Yeah. So the myths and the misconceptions will never stop. But the most important things, vaccines are very important, and they have been working wonders. Yeah.
All right. Mr. Malo, if I can get you back, you were talking about endemic areas. What do you mean when you say that?
Okay, so when you say an endemic area, this is an area or areas that are very much prone to malaria cases or the malaria disease. So we might find that an endemic area has got a high infestation of mosquitoes or mosquito that cause malaria. So we have places, for example, like places that are swampy or that have got a lot of water that perhaps may not easily be drained in order for the mosquitoes to be completely done away with. And that area, if there are people who live around those areas, you'll find that they are prone to mosquito bites. So those are places which have where mosquitoes easily breed around and have access to blood meals for them to give malaria to people. So endemic areas, they are areas where usually malaria cases come from. Yes.
Okay.
Maybe just in addition.
Yes.
Like if you look at one of the examples we can give of endemic areas, Copper Belt is one of them. Luapula, northern, northwestern. If it's Luapula, it's well known. 60% of that area is water. So mosquitoes can easily breed there, and it's very easy for them. Because even when you look at, obviously, if you look at the death of malaria, the cause of death of malaria in Luapula, the cause of death in Luapula, malaria should be one of the leading causes of death in Luapula.
Okay.
Yes.
Is malaria contagious? Because if one gets malaria in the house, they would say, Paka, everyone should have malaria.
Okay, so let me tell you what I grew up hearing from people and what education has done to me. You know, there are people who say when you get soaked in the rains, you can have malaria, okay? And then there are people who say
when you eat small mangoes,
yeah, I can even they talk about, is it mumps?
Yes.
And all those things. When you look at those things, I think for the small mangoes, parents were trying to communicate to say, let the mangoes ripe, then you have the fruit, because it was just a way of scaring children to eat mangoes when they are not ripe. That's number one. Number two, rains cannot cause malaria. Malaria can be only caused by a female Anopheles mosquito through a bite from an infected female Anopheles mosquito. There's nothing like when you get soaked in the rains, you're going to get malaria, or no, when you eat the unripe mango. Those are myths.
Yeah.
They don't exist.
Now, if suppose someone has malaria in the house, they are bitten by that mosquito, and then it beats another one. How is that logic? Because people are confusing themselves, or they are confused. They believe that once that mosquito bites a patient with malaria, then it goes to bite someone who doesn't have malaria. Then they all have malaria also.
So a mosquito, as long as an infected, can bite as many as people as it can.
Yes.
Okay, it can infect, one mosquito can infect even the whole household. As long as an infected.
But it should be a female Anopheles mosquito.
Yes.
Okay.
That's a specific. You know, malaria, we have got 4 types of malaria.
Yes.
By the way, maybe people, just to highlight, we've got 4 types of malaria. We've got malaria vivax, we've got Plasmodium vivax, Plasmodium falciparum, we've got malaria, we've got falciparum, vivax, malaria, and what's the last one? Ovale. Okay, but in Zambia, the most common one that we have is Plasmodium falciparum, and that's the most, one of the deadliest actually.
Okay.
Yes. So, when you get malaria, there's a lot of processes that happens in the body. Okay. When I was just new in this profession, I was doing my last attachment, I think my first, second or third attachment somewhere in Chirabombwe. So Chirabombwe is divided by Kafue River. There's a long river bank there. You know, there are villages surrounding those areas. At times when you're in Copper, especially when you're in Chirabombwe, every patient is tested for malaria, regardless. It's different from Lusaka. In Lusaka, we even compromise and wait. I've seen a family of 3. They died at one spot, children. One was, I think, 8, the other one was 4, the other one was 2. And they had hepatomegaly, the liver enlarged because of the parasites. So malaria is that deadly. There are many complications of malaria. Malaria is still one of the leading causes, like Mr. Marao said earlier. So in certain areas, the malaria is not a joke. And it will never be a joke because it hammers people like big time. So when you talk about malaria, people should take it very seriously. Me, I don't like people go to the pharmacy. I am not saying they shouldn't go to the pharmacy. The pharmacy should be, someone has to recommend you to go to the pharmacy. The right thing has to be done. Okay? Because there's a difference between a pharmacist and a clinician. A pharmacist, their job is to prescribe, is to dispense, maybe even prescribe and give a correct prescription. But there are certain things that we learn differently, okay? Me, my job, I'm a diagnostician. I'm going to look at symptoms. I'm going to take history. I'm going to understand how things happen and get a point. So when they go to the pharmacy, they'll just be given, the way you're feeling, maybe it's common cold, get this. Well, that person, they've got malaria and it's multiplying in their body. So when you come to the hospital, the first thing we do, RDT, because RDT is a rapid test. That one within 15 minutes or less, you get the results. Or it's positive, okay, no, but they don't look okay. They look confused. What could be? This is severe malaria. So you start someone with Coartem who has got severe malaria, you're not treating the person. They're killing them. Because Coartem at that point is not going to do much. You've seen people, I was on Coartem, but nothing changed because the severity of malaria had gone, it was very bad. It was very severe. So when you go to the hospital is going to guide you. They are going to do the right thing. They are going to tell you what to do. We are a team. Me, I like working in team because even my malaria is diagnosed. That's from OPD. Someone would do the temperature there, will be like, this is fever. Doc, I think this one can't stay on the queue. Can you see them quickly? Oh, okay, really? You screen? No, I think this is malaria. Lab. You see, this is a team. From the nurse to the CO, from the CO to the lab. The lab will like, this is severe malaria. Back to the CO. The CO will say, okay, now I'm going to admit you. You admit. The pharmacist is going to dispense. It's a whole team. We work as a team. We're a family. So what I'm trying to say is patients should understand, should know when to go to the hospital. Because, in Zambia, it's very difficult to treat certain diseases when there's certain extensions. Because we have got very few specialized hospitals in Zambia. Okay? Like, we are lucky in Lusaka, UTH is just nearby. Living is nearby. But let's talk about, let's say, even where I come from, in Shirabombwe. That's my hometown. If someone is diagnosed with, maybe they have a disease that they cannot manage in Shirabombwe, we don't have a district hospital there. Nchanga will not handle. The Quito will also not handle. They take to Ndora. Now, how many districts and how many kilometers? And the person needs urgent care. So what I'm trying to say is it's very important to have the disease detected early. And even cancer, when it's detected early, it's curable. But people don't want to go for screening. People don't want to do certain things. So malaria is still one of the leading causes of death in Zambia, and we should take it seriously and personal.
Okay.
Yes.
Now, is there a role that malnutrition play in malaria, especially in children?
Yes, very much. When the child has got malnutrition, what's happening there? They have got a low immunity. And when you have a low immunity, anything can attack you. So malnutrition plays a role in the severity of malaria. Someone who doesn't have malnutrition, and someone who has malnutrition, they get married at the same time. The person with malnutrition, they're likely to die faster than the person who doesn't have malnutrition. Why? Because the immune system helps to defend and prevent our bodies from sicknesses. The body fights a lot. I'll give you an example. Do you know why children have fever when they have malaria? Do you know why the body goes up? Do you know why the fever goes up? That fever is not, it's a signal telling you something is wrong. Because the body is trying to make the environment not favorable for the parasites, hence also causing harm to the host. So a child who has malnutrition, they are likely to die faster than the child without malnutrition. So that's why you have to make sure that children are supposed to be fed well-balanced meals and monitored and taken to under 5 clinics so they can be monitored properly. Yes.
Okay. Now, you mentioned about children. There are children that can say, I'm feeling this, I'm feeling that. Now, those children who can't even say how they are feeling, how does early, what can I say? How does early diagnosis improve malaria outcome in children?
Okay, so for starters, I work from the pediatrics. I occupy Pediatric Center of Excellence. My facility is quite nice, interesting. We work as a team. So usually children who come early from the facility, actually, I've been there for almost a year. Personally, I'm talking about me when I'm there. I've never witnessed a death. Personally, when I'm on duty, the time that I've spent at the facility, it's very rare. Because our environmental health personnel, they're able to do a good job by sensitizing the community. We give mosquito nets to pregnant mothers, I see a very good team that does good with health education. If people know, they will avoid. If people don't know, they will succumb. You get the point? So most people don't know really what to do and how they're supposed to do it. So that's why I said in health system, we work as a team. I cannot, my job will be easier if he does his job right, because he's a health promotion officer. I get the point. If he goes and tell people to say, use condoms, they'll use condoms and they will have less numbers of HIV and STIs. If you tell people go and use mosquito nets, we have less numbers of mosquito. I know mosquito nets alone cannot prevent malaria per se, but 95% they help in prevention of malaria, because studies show mosquitoes bite between 22 and 04 hours in the morning. So even in these periods where malaria are more prevalent, the hot season, people are encouraged to wear long clothes. There are so many preventive measures.
No, it's hot. You are putting on.
No, not really long. They are those, but at least.
They are lighter.
Yes.
Okay. Now, tell us what are some of the long-term effects of recurrent malaria infections in children?
So number one is what we call stunted growth. Children who have got recurrent, even just any disease.
Even malaria?
Yes.
Okay.
Because, when they have got malaria, most people they have loss of appetite, they are irritable, they don't want to be touched. When you touch them, they cry. You want to feed them, they cry. The immune system keeps on going low. And then how are they going? They are not eating also. They are vomiting. So recurrent, that period of time when the child is supposed to feed properly, it takes a month for them to eat. Again, after when they recover 2 weeks later, again they have malaria. They are not eating properly, no balanced meals, because again they have to compromise on what to feed them, because when you feed them this, they're going to vomit or they're going to choke, so you have to choose food and all those things. So it becomes difficult. So failure to thrive, which is stunted growth, it becomes more if a child has got recurrent cases of malaria. Yes.
So if they have recurrent cases of malaria, do you keep on giving them maybe these drugs like Coartem or maybe other drugs that suits their infection?
So it all comes back to...
And is it safe for them in that way?
So in treatment, malaria is treated, like I said earlier. When a child comes with malaria, first, we are going to classify it. Is it severe or is this just this malaria, okay? So if it's normal malaria, we give a combination of artemether and lumefantrine, which is called Coartem, okay? And when it's severe malaria, that's why now we have alternated to artesunate, because the other drug had so much side effect that people couldn't tolerate it. It had even like where people lose hearing and what was the drug again? Quinine. Yes. So it was long phased out, but it's used in severe, especially in pregnancy. It's still being used to some extent, but we no longer recommend it. Artesunate is the drug of choice for severe malaria in Zambia. You can either give it IM or IV. So when a child comes with malaria, that's why I said a pharmacist will give you the drug Coartem, but what the Coartem they are giving is going to treat only. It's not going to treat the severe malaria which is in the child, okay? Because the drug of choice, if the malaria is severe, maybe the mother will even say. But most pharmacists, if they hear the child was convulsing, the fever is too much, they recommend to say go to the hospital. Here we'll give you the Coartem, but please go to the hospital. You get the point. That's the most important thing.
Okay, I think we tend to overlook that as parents, because if you are given Coartem, then you are settled. Even though you are told to go to the hospital, I think we don't pay attention to that. There should be more sensitization, explaining the types of malaria, so that the communities can understand. Because if I'm given Coartem, it ends there. The Coartem I can just even buy for myself. Maybe in 2 days' time I'm okay, without knowing that there's something wrong still going on in my body.
I'll give you another practical example, especially in regards to STIs. STIs are very common, like very, very common. Just that we don't come out and say STI, but compared to malaria, actually STIs, they are committed every day, everywhere. Then choose, there's no endemic area for STIs. But most people, they go to the pharmacy to get a prescription, okay? This is syphilis you are treating with ciprofloxacin, okay? You give ciprofloxacin for 5 days. And then maybe even give most these people working in the pharmacies, most pharmacies don't have a lot of professionals because I don't know why. They have maybe one farm tech and there's also a pharmacist assistant, okay? That person did maybe teaching or maybe didn't even go to school, but they just understand drugs. But they don't understand at what extent someone's supposed to go to the hospital. So a person who has syphilis has got 3 stages, primary, secondary, and tertiary, okay? So you go to a pharmacy, you're already in secondary, okay? And then you're treated for primary. So how is that going to help the situation? So it's the same thing with malaria. A child comes, I know he has been having fevers because mothers, I work in the, like I said, I work in the pediatric center. So mothers come with excuses. I know we've been given Panadol, at least we get Panadol 2 days, Kasoberako, then again, Kaboyera food. So I'm like, so you gave Panadol, Kasoberako, you just stayed home. You get the point. You'll find that they've just been giving a child Panadol and they're sponging and Kaverako bwino kasovera.
Kama kafiva kama emba kumazuru.
Yeah.
You get the point? They go back home. Kapanado, they even go. Most of in these areas, most people are doing these works where it requires them to go maybe for work at 5:30, 8 in the morning. Most of them they are caregivers somewhere, like yeah. The boss is, you are going to take care of another person's child, but you're leaving your child sick at home. That's the most common thing in areas where we're working from. You find the child has been sick for 5 days. When I was at Ngombe Clinic, we used to have a child has been sick for, especially, I don't know what's with people and coming to the hospital on Mondays, not the weekends. You find the child. You find the child is sick on Friday, they will keep that child. Saturday, Sunday. They come Monday, now 12 hours. Not even in the morning. The time you're attending to that child, they're already gone. So me, I always tell people in the screening room, because if you just leave it up to one group, you say, no, health promotion is only for Mr. Malao, or it's only for the EHTs, you're also contributing to the disease.
Yes.
Because when you treat a person, you don't treat only by medication, also verbal. You tell them, the drug that I've given you, you have to give it ABC. And there is, please come back to the hospital as soon as possible. You are not a doctor. You are a mother. Even me, when my mom is sick or when my relative is sick, in that moment I'm not a doctor. I'll leave it to my friends to do it because of who? Ethics. You get the point?
Yes.
So it's very important that as we treat these children in the hospital, it's very important to give healthy education. We shouldn't just leave it to Mr. Malao to go and do it. Actually, because him will do it maybe with the masses, me I have a chance to do it one-on-one. And patients respect that white coat. They hear what we tell them. Okay? It's very sad that even one of these days where I was working, this child came with almost a tongue cut half. So and then as we call them a Dr. Mboya. So as a tongue, so the child was almost, the tongue was almost cut, the child was bleeding, and that child would have died if they didn't come early. Because the blood was going to the airway and clotting in the air. So when they came, they started splitting, they had to refer to ENT, UTH. So what I'm trying to say is, there's a reason why people go to school and do certain specific courses. So don't think my grandmother did it to everyone, even this one. Nowadays, life has become modern. The hospital is open to everyone. Mandevu is open 24/7. Sunday to Sunday. We work. You will find people there. There's never a day.
So my
It's a bit.
All right. Now, as we get to the end of our discussion, I think there should be a take-home message for our viewers out there, someone who is watching, wanting to get more information about malaria, especially in children, because as an adult, you can say, okay, I think these are really symptoms of malaria. Then you can go to the hospital. But concerning children, what is your message to the parents out there as we close our conversation?
Maybe start with you.
Okay. For me, I would say as parents or caregivers, let us ensure that we make our children sleep in the mosquito nets. And when the time for indoor residual spraying comes, let us allow the spray operator to spray our houses so that we prevent it from malaria. And when we see signs and symptoms of malaria in anyone, either children or adults, let us rush and go to the nearest health facility for medical attention.
Okay.
Yes.
Mr. Mbuta.
So for me, I'll still insist, the pharmacy exists for a purpose, is to prescribe, but all the time when a child gets sick, let the medical personnel give advice that prescribe, then you go to the pharmacy. Because it's very important for a professional to give advice, especially in that field of malaria, than just going to the pharmacy. Malaria has got a severe form.
I think what parents fear to come to the clinic, like you mentioned, people come when it's getting worse. It's because kumankala line kuchipatala and pamene mwangali line.
I'll give you an example.
I think you have a good experience because
Yes,
you interact with people.
But I'll tell
every
you
day.
something. Queues in every country or part of the world, they are there. Okay? But there's what we call triage. Okay? And this is one thing I keep on emphasizing even now at Mandevu. Because I tell patients one-on-one, when you come here, if you come at 4:30 with a child with normal temperature but cough and diarrhea and vomiting, and they're dehydrated, and then someone comes at 8 hours with a high temperature for diarrhea and vomiting, maybe even unconscious, we'll skip your child, we'll see the other child. That's why there is triaging. You treat patients according to the emergency. So most of them, they don't know that part. When a child is very sick, you are at liberty to come and explain. You can even talk to the person you find, especially at triage, you can explain to the nurse, can I talk to the doctor or can I talk to you privately? The problem with our people, they don't know how to ask. So when you have, even we understand when someone has got a program, they come to the hospital, we like those people. Because meaning they have first put health first before they can go and do whatever they want. You can come and ask, no, me, I'm supposed to go and do it. My boss wants me to go and take care of the child. But I have this sick child at home. What can I do? We advise. We will even skip them. We talk to the other patients. No, look at they understand. The most important is dialogue and understanding each other. Yes. So if we talk about queues will never finish because doctor ratio in Zambia is very high.
Yeah. Okay.
We haven't gotten to that point where we have one doctor, one patient. No, we are still one doctor, 1,000 patients. Maybe 100 patients. Yeah.
Okay, thank you so much for coming to this program. We really appreciate.
Thank you very much.
All right. Viewers, we were discussing malaria in children, and as parents or caregivers, we are at mandate to make sure that our children receive the best medical care. If you look out for symptoms, signs and symptoms that your child is presenting, especially those children that can't even say anything of whatever is paining in their bodies, make sure that you rush them very quickly so that they can receive health services at a very good time, so that this malaria, we have heard that it is in types. You might give them prescribe at home. You don't know what is happening in the body of your child. So make sure that you rush them to the health facility, or you rush yourself to the health facility so that you receive health services on time. All right, I was talking to Mr. Afet Mbotao, who is public health scientist, as well as clinical officer general at Mandevu Pediatric Center, and also Mr. Malao Jonathan, who is a health promotion officer as well as an environmental health officer from Lusaka District Health Office. All right, this has been Christabel Mungachilea. Thank you so much for watching. Till next time.